Hi, Dr. Tom McDonagh here with Good Therapy SF, located in downtown San Francisco. Today we're going to be talking a little bit about our anxiety thoughts. In particular, I wanted to focus on what we call the externalization of our anxiety thoughts. So what do I mean by that? When it comes to our mental health thoughts, anxiety in particular, we tend to assign a sense of self-blame to our thoughts. And that is what we call the internalization, when we assume it's our fault or it's something that we control what we think. But in much the same way that you would not blame yourself for the symptoms that come along with having the flu, let's say, you wouldn't want to blame yourself for the symptoms that come along with anxiety, right? You wouldn't blame yourself for having a fever if you have the flu. And in much the same way, we don't want you to blame your worry thoughts as though it's your fault. It's simply a symptom of a mental health disorder. So one of the ways in which we can work on externalization of these thoughts is to do what we call labeling. There are many different types of labels we can put on them. David Burns talks a little bit about what we call cognitive distortions. Two of the more famous ones with anxiety are catastrophizing, which is assuming the worst case scenario is definitely going to happen in this moment. And then the cousin of catastrophizing, which is future tripping, which is assuming the worst case scenario is definitely going to happen in the future. So simply checking in with yourself and seeing like, oh, this thought is part of a catastrophizing thought, or this thought is a part of a future tripping thought, is going through the labeling and therefore putting an externalization on these thoughts. And that's a really skillful thing to do because, again, it removes that self-blame that can happen when you say, oh, this thought is simply part of my anxiety diagnosis and not my fault or necessarily something that is wrong with myself. Another common label or way to externalize these thoughts is to use what Lenihan, one of her skills, which is simply think about these thoughts in kind of a cartoonish or kind of a funny type of voice way. It might seem a little bit silly, but it gets to the point of recognizing that these thoughts aren't necessarily true, but these are thoughts that are just the symptom of a diagnosis. So again, we call this externalization, which is where you take a type of skill and apply a label onto those thoughts, and it helps you externalize and see that these thoughts are more of a symptom of a diagnosis and not something that you can blame yourself for. So one more skill you can pick up from here at Good Therapy SF. Look forward to talking to you soon. Bye.